Welcome to the Bright Eyes Podcast, advice for healthy vision for all ages. Your hosts are Dr. Bonilla-Warford and Dr. Beth Knighton, residency-trained optometrists providing eye care to all ages with exams for glasses and contacts and specialty services including vision therapy, myopia control, orthokeratology, and sports vision training. Their mission is to empower patients by providing the best in friendly, professional, and individualized eye care.
From partial eclipse territory in Tampa, Florida, it's the Bright Eyes Podcast. My name is Dr. Bonilla-Warford, and I'm excited to talk about this important topic. There's lots of people that are talking about the upcoming eclipse, and I think that that's great, because this is a once-in-a-lifetime opportunity for lots of people. I don't know if you remember the eclipse that occurred in 1979. I do remember getting together with people and watching it. This is the first total eclipse to cut a cross-continental path over the United States since 1918. And lots of people are going to be watching the eclipse. There's only a small band from Oregon to South Carolina, where about 12 million people live, that they're going to be able to see the total eclipse. I have friends that are traveling to that narrow area so that they can see it in person. But the reason why I'm doing this episode of the podcast is not so much for the astronomical interest, but because of the potential for harm that could happen if you are not prepared. Now, last episode, Dr. Beth and I talked about types of damage that can occur both short-term and long-term from ultraviolet light. Well, when we're talking about the eclipse, when we're talking about actually looking at the sun, this is ultraviolet light damage on steroids. Now, you've been told probably your entire life, do not look directly at the sun. And that's true at all times, but it's especially true during an eclipse when the most interesting thing going on is the sun and its relationship to the moon and the earth. Why that's such a big deal is because there is something called solar retinopathy, or sometimes called eclipse blindness. And what happens is, if you look directly at the sun, the focused light of the sun can cause permanent damage to the back of the eye. However, the back of the eye does not have any pain sensors, so you won't feel any pain or see any symptoms right away. What will happen is later that day or the next day, you might notice that you're having trouble seeing. Just as a quick example, if you ever look at a strobe light briefly, or if you look at a light bulb that doesn't have a lampshade on it, you see what's called an after image. And it's just a little image that you see for a little while, and it's different colors, and it slowly fades away. That is where the photoreceptors of the back of the eye are overstimulated, and it takes a while for them to get down to regular levels. This is a completely different phenomenon. This is where there's actual damage to the back of the eye. And so while it's very exciting, and I do encourage everybody to check it out, I do want everybody to do that safely. So I have 4 items that were published by the American Optometric Association, and I'm going to read them and then comment on them just a little bit. Number 1, use approved solar eclipse viewers. The only safe way to view a partial solar eclipse is through special purpose solar filters, such as eclipse glasses or viewers, that meet international standards ISO 12312-2 for safe viewing. Sunglasses, smoke glasses, unfiltered telescope or magnifiers, and polarized filters are unsafe. If you can't find eclipse viewers, build a pinhole projector to watch the eclipse. So a couple different things here. First of all, pinhole projectors or pinhole viewers are pretty cool. And you can do that anytime. You don't necessarily have to do that during eclipse time. And so I would encourage anybody to check that out, and I'll put a link in the show notes. But mostly people are going to use solar eclipse viewers. And what I really want to point out about that is, 1, do get them. They're very inexpensive. We've got some for the staff because it's happening during business hours, and you can get them many different places. We'll put a link. But the most important thing is, I've read news articles about how there are fake solar viewers, and so you should test yours out to make sure that they're safe. And the easiest way to test them out is put them on and make sure the only thing that you can see through them is essentially the sun. Anything that's less bright than the sun, like a computer monitor or a flashlight or a light in the house, should not be able to see through it. If you can, then that's not safe. The other thing is they do sell filters for telescopes, and it's very important that you not use the viewing glasses or the Eclipse glasses to look through the telescope, because the telescope has concentrated that light so brightly that that's not anywhere near sufficient protection. Number 2. Technique of the pros. Before looking at the sun, cover your eyes with the Eclipse viewers while standing still. Glance at the sun and then turn away and remove your filters. Do not remove your filters while looking at the sun. So this accomplishes 2 purposes. First of all, you can't wear the solar viewing protection full time because you can't see anything. I don't know if anybody remembers the peril-sensitive sunglasses from Hitchhiker's Guide to the Galaxy. It's kind of like that in scary situations. So you can't just wear these all the time. But what you want to do is you want to position yourself so you're not walking around, put them on, look at the eclipse, look away, and then take them off. That ensures that you're protecting your eyes from the sun and you're protecting your body from walking around. Number 3, totally awesome. Only within the path of totality can eclipse viewers safely be removed to view the eclipse. Once the sun begins reappearing, however, viewers must be replaced. And so this is true, but I still want to provide a note of caution. The eclipse is only going to be in totality for 2 minutes and 40 seconds. So during that time, if you're in the path of the total eclipse, you can take off your viewers, you can look at the eclipse. However, I don't encourage you to do that for very long, because very quickly the sun's going to reappear and you're going to be at risk again. So I would only encourage you to do that for a short amount of time and then replace your viewers as the sun becomes exposed. And finally, visit your doctor of optometry. If you should experience any discomfort or vision problems following the eclipse, visit your doctor of optometry for a comprehensive exam. Now, of course, we recommend that people get exams regularly anyways, but this is one of those special situations. So I have a few other links that I'm going to put in about the eclipse that I think are interesting, the map, and some information about the solar viewers. I hope everybody enjoys it and has a great time. I'm very much looking forward to it. I know my kids are, but I mostly want everybody to stay safe. If you have any questions, let us know at office@brighteyestampa.com. We'll see you next time.
Brought to you by Bright Eyes Family Vision Care and Bright Eyes Kids. Find previous episodes, transcripts, credits, and more at brighteyestampa.com. Creative Commons Copyright Attribution Non-Commercial Use. Intro-outro music by Warford. The only purpose of this podcast is to educate and to inform. It is no substitute for personal care by a doctor. This podcast is provided on the understanding that it does not constitute medical advice or services. Please consult your physician for diagnosis and treatment.